multiple studies predict that over 500,000 Israelis are at risk of developing post-traumatic stress disorder in the aftermath of Hamas's brutal attack on Israel on October 7th and in the ensuing war. But many Israelis feel that there are not enough outlets to actually get the support that they need. Well, our next guest, Professor Yair Bar-Haim, joins us from Tel Aviv University's National Center for Traumatic Stress and Resilience. They've established a PTSD clinic for civilians and soldiers that are specifically helping reserve soldiers suffering from PTSD following the war. So, Professor, I'd love to hear about the work that this clinic is actually doing, but, I kind of want to start with more of a general question to begin with. You would think that a country that is so accustomed to dealing with war would also be accustomed to dealing with PTSD. But would you say that that's the case? Would you say that there are enough resources available to the public?
The answer is simple. It's no. The flood of people asking for treatment is very large. I think 500,000 is overestimation. I think we're going to have about 30,000 to 60,000 new cases of PTSD following this attack. But the Israeli infrastructure for treatment was suffocating even before the war started. There were large waiting lists in the public sector and also in the private sector, even up to 9 months of wait for treatment. Mm-hmm. And that basically means that there are not enough resources at the moment to treat all the people in need.
So tell us about this clinic that you have established and what the goal is.
Yeah, so basically the Tel Aviv University was gearing up to open the National Center for Traumatic Stress and Resilience in 2026. But because of the war, we opened the clinic component of the center. It's currently the largest treatment center that is focused only on PTSD. About 50% of our patients are reservists coming from Gaza and soldiers. Mm-hmm. About 20% more are from the Nova Party and also from the settlements around the Gaza Strip. And then just regular cases of PTSD mm-hmm. on a daily basis. It's a very large clinic. There are 33 therapists working very hard to try to provide the need. We expect to treat about between 2,000 and 3,000 people in the next couple of years.
And when you say treat, what kind of therapies are you going to be exposing these patients to? Is this just conversational therapy with therapists, or are there other methods as well to kind of help deal with PTSD?
Yeah, so we have several lines of treatment, and we always try to start with the most efficacious type of treatments, which are cognitive behavior therapies that are trauma-focused. Mm-hmm. But then sometimes it doesn't help enough, and we need to move on to additional lines of treatment. Some are also technology-based treatments. But they would come in the second and third lines for people who do not respond well enough to the first line.
I'm interested to kind of hear what the response has been of the patients that you have been dealing with so far.
First, they are very grateful that they can come in and receive treatment very quickly and without any bureaucracy, mm-hmm. and practically for free. We charge a very small amount, 50 shekels, just for them to commit to the treatment. But in fact, we provide treatment very quickly. We assess the psychopathology that people come with in 2 sessions, and then we are the fastest provider at the moment.
Obviously, there's the issue of individuals who have already been diagnosed with PTSD and those who are displaying symptoms or are dealing with just some kind of level of trauma that could later manifest into something that is more serious. When it comes to the patients and the people who are reaching out to you, how many would you say are people that just don't feel good and they're trying to identify what's going on with them, but haven't necessarily progressed to a point of dealing with PTSD itself?
Yeah, so we have some patients like this. Most of our patients who actually start treatment, all of them have PTSD, full-blown PTSD. Some patients mm-hmm. come in to verify that they are fine, and they will go through an intake process, and then at the end of it, we might tell them that they're actually doing better than they thought, and that they could do without treatment. It's important to say at this stage that about 90 to 95% of the people who were exposed to severe traumas recuperate on their own. They are resilient to the psychopathology. So that's the largest part of the population. But the people who come to us, they need treatment, and their symptoms are severe, and
right.
they go into treatment.
Well, I mean, I think it's really a fascinating issue. The whole idea of resilience in a country where you're dealing with war after, I mean, since the modern day founding of the State of Israel, the general public has been exposed to trauma after trauma after trauma. There are very few countries in the world that have dealt with kind of this level and amount of trauma on a daily basis. So I guess my question for you would be whether or not you think that is assisting and helping people self-medicate and take care of themselves, or whether or not you think there needs to be a change in the approach to dealing with mental health, especially among the Army.
Yeah, so we need a lot more therapists than we have. That would bring a change, an organizational change in the way the internship is going, and how can we train people to treat. It's going to be a process. Now, these numbers that I described to you, around 30 to 60,000 people, they're not going to go anywhere. It's a problem for the next couple of decades. Right. So the system will have to change its proficiency in treating PTSD. But there's one point I do want to refer to what you asked. People don't get stronger or experienced to experiencing traumas. If anything, additive traumas weaken the resilience of the population, and also on an individual basis.